Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I'm the prenatal and pediatric chiropractor here at the Cap Wellness Center. And today I'm very happy to say that we have Willow Buckley back with us. You may remember her from past episodes. She is a number of different things. She's a yoga instructor. She's a doula, she's a mom, but she is also a homeopath and quite an expert in many different aspects of pregnancy, postpartum, and childcare. And today, our episode is going to concentrate on earaches and natural remedies for earaches. So it's not only homeopathic remedies, but other natural remedies that she knows of that are effective and safe to use for your kiddos if they're having problems with their ears. So before we switch over to my conversation with Willow, let me take a moment, as always, to get a message from our sponsor, the Cap Wellness Center.
Hi, I'm Maureen Higa, and I'm the acupuncturist at Cap Wellness Center. One of the things I love about working at Cap Wellness Center is getting to be around all the brave, strong, and inspiring women. I'm always inspired by my patients' ability to rise to their challenges, overcome obstacles, and also get creative in their pursuit towards their health goals. I feel honored to be a part of their journey, whether it's helping them to start a family, have a healthy pregnancy, or helping them through their postpartum recovery.
All right, now let me refresh your memory about our guest, Willow Buckley. As I said before, she's been on the podcast a number of times talking about her book, which was about natural conception and healthy pregnancy. She's also done a couple episodes around homeopathy for pregnancy and for child care in a general sense. And this episode today is going to be much more specific around earaches. But Willow Buckley, she's a certified classical homeopath, labor doula, and prenatal yoga instructor. She first combined her holistic interest with her medical science studies while earning a Bachelor of Science in Neuropsychology from the University of California at Santa Barbara. Continuing her search and passion for whole healing approaches, Willow ventured into homeopathy, where she's helped families and individuals of all ages handle everything from anxiety and depression to morning sickness and sore throats. She's a fervent proponent of the body's power to heal itself and infuses nutrition with real food into her practice. She's also the co-author of the book How to Conceive Naturally and Have a Healthy Pregnancy After 30. She lives in Encinitas, California with her husband Marcus, a writer and a Montessori educator, and their children Grayson and Emerson. So now let me switch over to my conversation with Willow. Hi, Willow. Welcome back to the podcast.
Hi, Dr. J. Thanks for having me.
Okay, well, I'm happy to have you back. This is your fourth time back on the podcast. Our listeners, you've already heard Willow's bio, but she's also been on the podcast a number of other times. One, talking about your book that was published a while ago. We had a topic around homeopathy and pregnancy, as well as a general episode around homeopathy and infants and children, but today we're going to get more specific. But before we jump into that, give our listeners a little more context about how you work with kids and why you do so.
Yeah, sure. So I find as a mom of two myself, but even before I had children, when I was treating kids and infants in my practice, it's just such a vulnerable time for parents when they're kid gets sick. It doesn't matter if it's a low-grade fever or something really serious. It can be very upsetting because you don't know which way to go. You're not sure which tools to use. And some parents don't even feel like they have a toolbox and that they're really, really beholden to their pediatrician, which is generally only open 9 to 5, Monday through Friday. So homeopathically, I work with children and I set up acute consults. So it's kind of like a doctor's visit, but I can treat over the phone, odd hours. If parents like to get a hold of me beforehand, I can really set them up so they have kind of protocols and things to do at night or when it's not office hours, so that they feel like they have tools to treat their children until they maybe need to see their pediatrician or can come into my office And I really want to empower parents to be able to observe and treat as best they can preventatively and naturally for their children.
Right. And I think that's key in that, especially first-time parents, one, not having a toolbox is scary when you realize at 2 a.m. you don't have a toolbox to use.
Totally.
And the resources, kind of traditional resources that you thought you could rely on all those times is not open at 2 a.m. And Google's not the best place to always look for those kind of things. So
Definitely
I applaud
not.
you for doing these kind of things to teach our parents in advance of what kind of things to look for. And in the previous episodes, you've given us just great general information, but today we're going to be talking specifically about ear infections, and I hope this will be a series on a bunch of different specifics, so parents can learn more about it. But ear infections are definitely an issue for a lot of kiddos and can cause a lot of problems for parents not knowing what to do, but definitely catching it early is key. So how do you recommend parents do that?
Well, first and foremost, and I think I went over this in the previous podcast, but I'll just give you a little summary for homeopathy. One of the most important tools is observation and how you see your child in terms of detail, not just symptoms, but behavior, things that make them feel better or worse. So it really helps when you're dealing with an infant, one who can't speak or tell you that they have a hurt ear, and they're just crying out at 3 a.m. So I really like to teach in observation to look, you listen, you feel, you watch, you smell, and then you look at some generalities. So with an ear infection, sometimes they could wake up, they could be screaming. You have an 8-month-old. There's kind of a few different reasons they could be upset at 8 months, but tugging on their ear, for example, could be teething pain because that trigeminal nerve runs, as you know, from that jaw back towards the ear. And so they grab their ear while they teethe. One way to gently palpate the ear and see if it really is coming from the ear is you can gently take a finger and you can pull on the pinna, the outer part of the ear, away from the child very gently. If there is sensitivity or any kind of swelling or inflammation or even infection, that'll be generally too sensitive, and the child will whap your hand or cry out, or as well press on the ear and push in. And you'll be able to see. Some parents, I have an otoscope, I can look inside and see if there's redness or irritation. Parents can learn how to use one. So that's one way they can really get a handle on if it is the actual ear that is bothering them. Another great tell sign is when you lay your baby down. If you can calm them down while you're holding them upright and you notice, okay, they fell back asleep and then they start crying as soon as you lay them prone, it's usually because that pressure all of a sudden comes back onto the ear and it was away and off the ear and in that eardrum while they were vertical. So that's another kind of clue in the middle of the night. It's like, okay, we're probably dealing with an ear issue.
And that's, so you mean that the kid's not just laying physically on that ear that's problematic, but prone, just like laying on their back will increase the pressure.
Right. It can increase the pressure.
Okay.
So it's just another sign. And that's one thing I like, which is when we talk about feel, is you can feel, you touch it, you look at it. Is it red? Is there pus coming out? I've seen very pussy ears before from ear infections. So there's lots of ways to look. Do they have a fever? Do they feel hot? Did this fever come on really fast? Have they been tugging at their ear? Are they coming off of a ripe cold or the beginning of a cold? You just want to kind of take into count, were they out in the cold wind the night before, no hat, with a runny nose or some congestion. There's lots of different factors to look beforehand, but once you have an irritated ear, you can kind of use these tools to confirm that. You can also always go into your pediatrician and have them look and confirm if it's an ear infection. And they'll tell you, it will go away generally without any antibiotics. I've never had to treat children with antibiotics with the ear infections. Homeopathy and some herbal remedies generally nip it in the bud immediately. Or even if with antibiotics, you can use homeopathy in conjunction. Because sometimes I've seen very often the antibiotics don't even work. So what I want to do is really, once we think, okay, yes, this is the ear, it's 3 a.m., what do we do? We've noticed that, okay, maybe there is no cold or no fever. And the first step that I think is really helpful is mullein oil. So mullein and garlic oil. You can generally have this in your kit at home. Comes in a liquid form in a dropper. Gaia Kids or Gaia Herbs is the brand I used to use, just to let everyone know they no longer make liquid tinctures anymore or herbal formulas in the liquid form. But locally, if you're in San Diego, Jimbo's carries a great one. That's their own brand, and most health food stores will carry a garlic and mullein oil blend.
Mullein oil.
Mullein oil.
How do you spell that?
Mullen.
Okay. And garlic.
And it's
okay.
yeah, and it's mixed with garlic, so it's quite powerful in its odor.
Yeah.
So you want to use a towel when you're placing it in your ear, or in the child's ear. So this is one; it's not going to harm them. If you do suspect a ruptured eardrum, generally you're going to have more signs beforehand. And that's the only time you're not going to want to put anything in the ear, is if it's a full-blown rupture. Most often, you're going to have some signs beforehand that you're going to start using this, and because you're going to be observing your child, you're going to be right on top of it, and you're going to be like, oh, look at that, they're crying. Maybe they have a fever. Oh, they're just really screaming on their ear. There's no pus. There's no indication of any rupture. And so the first thing is the mullein garlic oil. What you want to do is put it inside a cup of hot water and then warm it up. So once you feel like it's a good temperature on the inside of your wrist, then you can put 3 drops in baby's ear. This works for any age. The main reason I speak about infants is because that's the one age that they do not respond or talk back to. So if we can kind of gauge on how to treat an infant, it's going to be that much easier to treat a 2-year-old or a 4-year-old or a 6-year-old or an 8-year-old, because they'll be able to give you a lot more information.
And so the hot water you're saying is to just heat up the container of the oil, or are you diluting the oil? No, okay.
Thank you for correcting that. It is actually just to heat up the container.
Okay.
So I usually get a nice mug, pour some, water in from my electric kettle, and I swirl it around, give it a few minutes, warm it up till it feels good on the inside of my wrist. Never hot, but just warm. Not even as hot as you would take a bottle. And then you do 3 drops right in the ear. Again, I like to lay a towel down over baby's shoulder and mom or dad's shoulder, whoever's holding baby. You can do it with just one person. I've done it a lot. It is helpful if both of you are awake. One can hold baby and the other one can just find it and drop it in. Okay. This is a great way to help soothe, and I see this alleviate a lot of discomfort right away. Now, the second part is fluids and keeping baby upright. So if this is something and you're trying to get back to sleep, you're trying baby to get back to sleep, or your child, give them a little prop, a little elevation, and that'll help them get back to sleep as well, because they won't have as much pressure. Another trick with older kids too is definitely redirection. So some kids are very sensitive to pain, and this will also indicate a certain remedy. But while you're trying to calm them down or do something, it's a lot of redirection. So getting a book out or getting a flashlight out and doing a puppet show on the wall, something to take their mind off of the hyperfocus that's on the ear. Because we tend to hyperfocus. Sometimes parents get all, oh my gosh, they got an ear infection. This is going to be terrible. What are we going to do? We have swim lessons tomorrow. And then the kid's like, oh my gosh, what's wrong with me? And gets more upset. So we haven't gotten really into the homeopathy yet, but we are going to get there, because these are all tricks that are going to help lead to more effective dosing later on. So those are the first parts. One small trick is, before even getting into the homeopathy, is if you're on an airplane, baby's got a cold, kid has a cold, one thing that works really well to help relieve the pressure is to get a paper cup, something they use to pour hot coffee in. Have the stewardess get a napkin, or you can use one of your own washcloths or something you have, and have her pour boiling water on it. And you shove that napkin into the bottom of that paper cup, and you cup the ear, and you steam it out. So if you're on an airplane, this can be very effective as well. It can also be effective at home, but when we don't have a lot of tools, when we're out and about or away, this is one way you can help find quick relief. Okay, so what about homeopathy? All right, here's the best part. Even if you don't have any of those things, say you don't have the mullein oil, you don't have the boiling hot water washcloth and a cup on the airplane, but you do have your homeopathy kit, this can be all you need. What I'm going to speak about are different remedies that indicate different types of symptomology for not just the ear infection itself or the earache, but for the type of child and how they respond to pain and how they react. Because both of those things are very important when picking a homeopathic remedy. In terms of dosage and how often to give, we'll go into that at the end. That way it's kind of fresh. Okay. We're going to go into the remedies first. So sometimes the first remedy, it's the easiest one to have. Sometimes I think it should be just in our purses at all time, is aconite. Okay. So that's monk's hood. It's a plant, and it's ACONITE. You can have it in a variety of potencies. It can come in a 3C, a 6C, a 12C, a 30C, a 200C. Those are the most common ones, or even a 30X. Any of them will do. It does not matter which one you have. I really like the kits on my website. They have everything in a 30C and the most common remedies in a 200C. So you get a nice variety. But again, whatever you have, I think it'll work because it's also going to be the only thing you have. So those are my favorite potencies to work with, though. So this is right at the onset of a symptom. You'll see the aconite child or someone who needs it. Maybe they were at that barbecue the night before in a cold wind, or maybe you guys had just landed in the mountains and kind of had a runny nose, and then boom, they were out all night in the cold, and that night you just see it, or the next morning, it's the ear. That's where it's moved into. They're very thirsty, and they might have the dry cough as well. Especially if it's a croupy, dry cough, aconite is going to be your remedy. If it's within the first 24 hours, which generally, given those tools beforehand on how to check and see if it's an ear infection or not, using aconite should help them get back to sleep immediately. They may or may not have a fever, but as soon as you suspect, you can give them this remedy, and it should help them get back to sleep. And so you can reevaluate in the morning, or if it is the morning or the middle of the day, you'll go ahead and give this remedy. And if it's from these particular symptoms, you'll see the ear is probably hot. There's definitely pain, and there's usually a fever with aconite. So aconite comes on fast, usually maybe out in the cold the night before or that day, and they're very thirsty. Possible dry cough.
And can I ask you a question?
Sure.
So you're talking about like the aconite comes on fast. Are you talking about that in terms of kind of like more in the constitutional homeopathy realm of like a kid is more like aconite prone, or are you talking about like an aconite type of presentation as far as in
this case, it's presentation. So because right now we're doing acute homeopathy. So we're doing something that comes on and we're treating what we see right in front of us right then. We're not taking into account kind of the whole system and how it's been perceived or experienced beforehand. Those things can help us find a remedy, but generally we want to look right now because some kids might have been tugging at their ear, complaining, or kind of talking about it, or they've had a little bit of a cold, and over a few days it starts to get worse. That's a slow onset. Okay. We're talking about the kids who go to sleep, maybe have a runny nose, but really no other symptoms at all, but wake up screaming, wake up in pain, wake up and have a new symptomology quickly, or wake up from their nap. It's usually after they sleep, I find, and it becomes a little bit more sudden because they're not as distracted by their play. Right. So when they wake up, it's much more pronounced.
Okay. Thank you for clarifying.
So, yeah, of course. Thank you for asking. And then belladonna would be the next one, or another one. I'm just going in alphabetical order of the top 5. So belladonna is similar to aconite in terms of that very fast, rapid onset. The difference for an ear infection with belladonna from aconite is there's generally 0 symptoms. They probably don't have that cold before, but they'll be in a lot of pain. The ear is very hot and red. When you touch it, you'll definitely feel it very, very warm. Their fevers are going to be extremely warm, flushed skin, flushed face. All movement aggravates. They're going to want to lie very still. They're not going to want to move. And they're definitely going to be worse at night. And again, that belladonna look is a flushed face, almost looks like their pupils are kind of dilated almost. They got that glassy look in their eye. And very, very feverish, like classic red-faced fever, very, very warm. And they can be extremely agitated from the pain. So they might scream, they could bite, they might kind of put up a little bit of a fight when you're trying to do the Mullein oil or give them a remedy or something, because they're just agitated by it. So because the movement makes it worse, really helping them calm down, getting the remedy to them will help soothe their whole system and get them back to sleep. So belladonna is for sudden onset, no other symptoms beforehand, bright red, hot, feverish, flushed, worse at night, needs to lay still, might have a tendency to bite or scream.
Okay.
The next one is chamomile. So this is a wonderful one. Most families are familiar with it because it's good for teething. Some people just use chamomile tea. They soak a washcloth in it and freeze it. That's really nice sometimes for teething on the gums. But chamomile homeopathically is really for severe pain. They're so irritable. They will definitely be screaming, but one way they handle it is when you're holding them, they arch away. They don't round in. They're that child that you're like worried is going to arch and like fly out of your hands backwards because they arch so much. They're pushing away from you. They're rearing back. However, they're better from being rocked and held. So they don't want to be put down, but they might really push away once they're in your arms. And a classic thing is with chamomilla is that child that refuses what they've asked for. So say you want to give them their favorite toy or go bring them something, or maybe they're pointing to it or they whine about it, and then you give it to them and then they throw it away. They just toss it back.
Right.
Or you pick them up and they're better, but every once in a while they'll just push you away. So they have a little bit of a cantankerous disposition when they're in this pain state, in this painful state. So they don't really know what they want, but they will definitely be better from being rocked. So they're the child that wants to be upright, bounced on the ball, or the baby bounced on the exercise ball, or just a lot of knee bends, a lot of those lunges that we do at night, you know, that's like that workout that we didn't think we wanted at 3 a.m. And they're going to be worse from going outside. They much prefer indoors. Chamomillas also, you might notice they could be teething at the same time. So if you notice they're breaking teeth or they've been really gnawing and chewing on things for the week prior, that's another sign, because often it can happen at the same time, which makes the pain that much more intense.
Right.
So chamomilla is extremely sensitive to pain, really sensitive overall, arching the back, really screaming, extremely irritable, refusing things that they want, meaning they don't really know what they want, and they really enjoy being rocked and carried. They're the ones that just do not put them down. You're sleeping, basically you're just on that ball. But when you give them this remedy, all of these remedies, if they're working, they're going to work within 15 minutes, 30 max, and that baby should be back to sleep, or the child.
Okay.
There's one more. Actually, there's two more. I'll add one more into this, is pulsatilla. So pulsatilla is another plant remedy, and the one thing that makes this remedy known for being effective for a child is the type of child that it really represents, which is a very clingy, very weepy, following you around, needs to be in your lap, like you can't even go pee or use the restroom without them, like you're having to peel them off of you, or maybe you just go and wash your hands and go about your business while you're holding baby. They're just on you. They're very sensitive and a little bit more morose and sad and cry. And they're more whining than irritated or irritable. So chamomilla is going to be, a little bit more feisty and irritable. And belladonna, they're more whiny, a little more sad. There sometimes might be a fever, but it usually comes with a nice ripe cold. So discharge from the nose. Often later cases I've seen pulsatilla work really well with ear infections that actually didn't respond to antibiotics and have moved into where it's yellow and green oozing out of the ear. It's bland, it's thick. Pulsatilla is definitely your remedy for any kind of discharge out of the nose, or the ear that is yellow and green. But they're going to be kind of the opposite. So they're going to be the ones that are better from outdoors. The second you go outside, they just kind of calm down. They enjoy outside. They always prefer to be outside. They don't like the stuffy rooms. It's one way to kind of check. So ways to find out is you can go and you're trying to calm a baby down or calm your child down. You can go outside and see if that calms them down. If it makes them worse, come back in, wrap them up in a blanket and see if all of a sudden that's actually what works better. They are usually not very thirsty. You're kind of having to force and prod them to drink. So especially warm drinks, unless it's breast milk. So they're the kind that you're really, really prodding to drink. Like, please, one more sip, just a little bit more. Mm-hmm. Here, you need to have your fluids because they just really have an absence of thirst. But an indication that's really clear, that's very different from the rest of them, is that clingy, kind of weepy disposition. That doesn't have to be their disposition all the time, although it might be, and just especially aggravated or heightened during an illness. And they would actually be like this all the time in all illnesses. So whether it's a fever or a stomach flu or anything else, they're going to want that person with them. There's one other that's not in here, but Heper Sulf. So Heper, HEPAR, Heper, sulfuricum, so sulfur, calcareum, so with calcium in it, the calcarea part. This is one other remedy for extreme pain. If none of these other ones are working, then this could possibly help. But I really think most ear infections, to get you through the beginning or even through the entire process, is going to be one of these four.
Okay. So then would you recommend parents having each of these on hand? Or do you recommend like one of them, and then if it's not resolving, you go to the store and get the other? Or how does it typically work?
Let me sneeze. Hold on real quick.
Bless you.
Thank you. So now we get into dosing. It's always better, in my opinion, to have them all.
Okay.
I definitely suggest having a homeopathy kit at home. You can get a small kit of 100 for, I think, $200. And that gives you 90 remedies in the 30 C potency and 10 in the 200 C potency, possibly one or two, maybe it's 89 and 11. I'll have to look again. Mm-hmm. But each remedy that you buy at a store is $7 to $10. So you're getting 100 remedies in smaller vials that are going to last you for years. I still have mine. I bought it 10 years ago.
Wow.
So, and then I just refill what I go through. It's an amazing investment. The other ones, they do have a 50 remedy kit that are fantastic. That's it. So either my website, balancingyourhealth.com, or at homeopathyworks.com, they'll have other ones as well. On my website, you get a discount because I can sell them cheaper than they do as a practitioner. So, it's best to have them all at home. So what happens? How do you give this remedy? So really start with the first one that looks the most appropriate. If you see, they're coming off this ripe cold, you grab your pulsatilla, and especially if it's in the middle of the night or if they're in severe pain, you give it to them every 5 to 15 minutes. Generally, every 15 minutes is enough, but sometimes they're very hard to calm down, and just the act of taking something and doing that little kind of, I call it a poking at the illness. You're kind of poking at it a little bit faster, a little bit more, helps alleviate it that much more quickly. So no matter which one you start with, if it's very severe, 5 to 15 minutes. If it's not very severe, you can start it every 2 hours. So meaning if it's the middle of the day, 10 a.m., my ear's kind of hurting, you do some mullein oil, you can give them that remedy every 2 hours. And then you can ask them, you can poke on it, you can push on it, you can use your otoscope, you can go back and get another diagnosis from the pediatrician if you've done that. I did that once with my baby. I confirmed before I had my otoscope that it was an ear infection. And I went back just to confirm 2 weeks later, or I think it was 1 week later, 1 or 2 weeks. I think it was 1 week later. Nothing was there, totally gone, absent.
Great.
Never did any antibiotics. And that's usually how it is with all my clients. So in the middle of the night, every 5 to 15, if they're not feeling better within 30 minutes, move on to the next remedy.
Okay.
They should be calmed down, headed back to sleep within 30 minutes in the middle of the night. I don't like to give 30 minutes for the middle of the day unless they're in severe distress or pain, where they're really overly, they can't calm down because of it, or they're hyper-focused. So during that time, I also always suggest parents reevaluate how you're responding to the incident or the infection or the illness, and try some redirecting and calming, as well as continuing to give the remedy. All those things will work in conjunction. If for whatever reason it's not feeling better within 30 minutes, you move on to the next remedy and you repeat in the same thing. I generally have never seen kids stay awake more than 45 minutes.
Okay. Well, that's good for a parent to hear.
Yeah. They usually go right back to sleep, which, gosh, sometimes they don't even go back to sleep that quickly in regular instances.
And I've known, thankfully my son Nico hasn't had an earache, but I know we've used the remedy for teething, and when he was super irritable with it, as you said, like within 30 minutes, like sometimes we wouldn't even get to the third dose because he'd already conked out.
Yep.
It can be so soothing for them, and that soothes the parents too.
Yeah, definitely. And I like to remind parents, do not wake up a sleeping child to see if they're okay. They're fine.
Right.
They're totally fine. If they're sleeping, they're fine.
Yeah.
If they have a fever while they're sleeping, that's fine. They're sleeping.
Right.
If they have an ear infection while they're sleeping, that's fine. They're sleeping. Their body is doing so much while they're at that deep rest. That is our goal, is to really give that body the chance to do so. And obviously, being a chiropractor, I'm sure you've done a ton of these. I highly recommend for keeping that whole section of the neck and all that cervical region nice and aligned if you have chronic ear infections. Homeopathic constitutional treatment coinciding with chiropractic, I see it work wonders. Yeah, I'm very fortunate. Combo. It's really wonderful. I've had one ear infection and it lasted 30 minutes. Got it confirmed. It was gone. I've been very, very fortunate as well. And I really do. I owe it to chiropractic and homeopathy.
Yeah. Ooh. And that's what we want for all parents, right? To be able to have like tools. Not that every parent needs to necessarily use chiropractic or homeopathy, but like going to those tools first rather than, traditional medical route, which has a whole host of side effects.
Yeah. Or if they find it's not working for them, this is an option that I think they would find very valuable and very effective.
Well, before we close up, is there anything you wanted to add on as far as, like, I don't want to cut you off as far as dosage information, if there was more to it?
Just basically within the 30 minutes, don't go beyond that if you're not finding any kind of improvement. And if there's zero improvement after up to 4 doses, if you're spreading it out over those 2 hours, then cease giving that remedy. I kind of always say, if it's not working, it's not working. Give it 3 to 4 doses. And then move on in an acute situation. Don't keep giving it. It's not going to suddenly work later in an acute situation. You want something more effective, faster.
Okay, good advice. So as we're finishing up here, tell our parents that are listening how they can get in touch with you and possibly either, learn more from the info you have on your website, but then also maybe book appointments, so because you can do things remotely, whether you're here in San Diego or around the country or the world. Yeah,
that's great. So acute wise, if they come up with a cold, an ear infection, fevers, whatever it might be, I do Skype consults or phone consults, so that's an acute consult, and I have packages of those on my website, balancingyourhealth.com. You can email me, willow@balancingyourhealth.com, and then if you find chronic issues where, wow, my kid's always getting ear infections, constitutional treatment, which is likely a remedy outside of these 4, will help. But if you go to my website and you sign up to be part of my tribe, then you will get access to my ebook, which actually has a ton of ailments and all the literature that I just gave you written down in this ebook that is roughly, oh gosh, how long? I don't know. It's like 36, 40 pages of information for kids and infants.
Great. I'll make sure that that link is in the show notes and on our website. So if you're listening to this, you can click onto it and definitely, become a part of Willow's tribe. It's a good place to be for sure. In our closing minutes, Willow, do you have any, what's the major take home you'd like parents listening to this to take home from our episode today?
Yeah, kids get sick and it's okay. So, recognize your own reactions to it and find out and experiment and inquire so that you can empower yourself with your own toolbox, because there's a lot of stuff you can do at home, especially in the middle of the night, that is safe and effective for your whole family.
Good. Well, and I appreciate your, tips on observation, because as a parent, that's obviously where it starts, and that's not going to just help you with sicknesses, but other, kind of emotional disturbances or things like that. So you can just be that much more connected and engaged with your kiddo, which, allows you to nurture them along. So I thank you for starting with that.
Yeah, of course. Thank you.
Well, thank you for being on again. I would love to have you back. We can jump into more specific topics again, like ear infections. We could do another on fevers. We touched only briefly on that. I know I get a lot of questions about that. And then, just possibly have some recurring episodes so parents can get more information like this about those other topics.
I'd love to. It sounds fabulous.
Thank you, Willow.
Thank you so much,
All
Dr.
right.
J.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.